Question 1. A nurse is prioritizing care for 4 oncology patients. Which patient requires immediate assessment? A. A patient with a platelet count of 90,000/mm superscript 3 and bruising. B. A patient with a temperature of 101.8 degrees Fahrenheit and neutropenia. C. A patient reporting mild fatigue post-chemotherapy. D. A patient with dry skin after radiation therapy. Answer. B. A patient with a temperature of 101.8 degrees Fahrenheit and neutropenia. Question 2. A nurse delegates tasks for a patient receiving immunotherapy. Which task is suitable for a UAP? A. Monitoring for immune-related adverse effects. B. Assisting with repositioning in bed. C. Administering oral corticosteroids. D. Assessing for respiratory distress. Answer. B. Assisting with repositioning in bed. Question 3. A patient with colon cancer reports sudden, severe abdominal pain. What is the nurse's first action? A. Administer prescribed analgesics. B. Assess pain characteristics and vital signs. C. Encourage deep breathing exercises. D. Notify the physician immediately. Answer. B. Assess pain characteristics and vital signs. Question 4. A nurse assigns tasks for a patient with lymphoma receiving CHOP chemotherapy. Which task requires an RN? A. Assisting with oral hygiene. B. Monitoring for signs of anaphylaxis. C. Measuring daily weight. D. Transporting to the imaging department. Answer. B. Monitoring for signs of anaphylaxis. Question 5. A patient on oxaliplatin reports tingling in the hands and feet. What is the nurse's priority action? A. Continue the infusion and monitor symptoms. B. Stop the infusion and notify the oncologist. C. Administer an antihistamine. D. Encourage warm compresses. Answer. B. Stop the infusion and notify the oncologist. Question 6. A nurse is caring for a patient with a chemotherapy port. Which finding requires immediate intervention? A. Mild discomfort at the port site. B. Erythema and warmth around the port. C. Clear dressing over the port. D. Patient reports itching. Answer. B. Erythema and warmth around the port. Question 7. A patient with lung cancer receiving pembrolizumab develops a cough. What should the nurse monitor closely? A. Alopecia. B. Immune-mediated pneumonitis. C. Nausea. D. Fatigue. Answer. B. Immune-mediated pneumonitis. Question 8. A nurse prioritizes care for a patient post-stem cell transplant. Which symptom indicates a critical complication? A. Mild oral mucositis. B. Shortness of breath and tachycardia. C. Hair loss. D. Decreased appetite. Answer. B. Shortness of breath and tachycardia. Question 9. A nurse delegates tasks for a patient with breast cancer. Which task is appropriate for an LPN? A. Assessing for lymphedema. B. Administering prescribed oral pain medication. C. Developing a discharge plan. D. Educating on chemotherapy side effects. Answer. B. Administering prescribed oral pain medication. Question 10. A patient with liver cancer reports dark urine and clay-colored stools. What is the nurse's first action? A. Encourage increased fluid intake. B. Assess for jaundice and liver function. C. Administer a laxative. D. Notify the hepatologist immediately. Answer. B. Assess for jaundice and liver function. Question 11. A nurse assigns tasks for a patient receiving external beam radiation. Which task requires an RN? A. Assisting with repositioning. B. Evaluating skin reaction severity. C. Providing oral hydration. D. changing bed linens. Answer: B. Evaluating skin reaction severity. Question 12. A patient with acute leukemia develops petechiae. Which laboratory value should the nurse prioritize? A. Serum sodium. B. Platelet count. C. Blood urea nitrogen. D. White blood cell count. Answer: B. Platelet count. Question 13. A nurse cares for a patient on denosumab for bone metastases. What is a priority intervention? A. Monitoring for nausea. B. Assessing for hypocalcemia. C. Encouraging a low-calcium diet. D. Limiting ambulation. Answer: B. Assessing for hypocalcemia. Question 14. A nurse delegates tasks for a patient with pancreatic cancer. Which task can a UAP perform? A. Monitoring for jaundice. B. Assisting with meal setup. C. Administering pancreatic enzymes. D. Assessing pain levels. Answer: B. Assisting with meal setup. Question 15. A patient receiving carboplatin reports hearing changes. What is the nurse's first action? A. Continue the infusion and document. B. Pause the infusion and notify the oncologist. C. Administer an antiemetic. D. Encourage rest. Answer: B. Pause the infusion and notify the oncologist. Question 16. A nurse prioritizes care for a patient with head and neck cancer. Which finding needs immediate action? A. Dry mouth. B. Difficulty breathing. C. Sore throat. D. Weight loss. Answer: B. Difficulty breathing. Question 17. A nurse assigns tasks for a patient newly diagnosed with melanoma. Which task requires an RN? A. Measuring vital signs. B. Providing education on skin checks. C. Assisting with ambulation. D. Recording intake and output. Answer: B. Providing education on skin checks. Question 18. A patient with gastric cancer reports hematemesis. What is the nurse's priority action? A. Administer an antiemetic. B. Assess vital signs and bleeding severity. C. Encourage small sips of water. D. Notify the gastroenterologist immediately. Answer: B. Assess vital signs and bleeding severity. Question 19. A nurse delegates tasks for a patient receiving targeted therapy. Which task is suitable for an LPN? A. Assessing for rash severity. B. Administering oral antiemetics as prescribed. C. Developing a symptom management plan. D. Educating on therapy risks. Answer: B. Administering oral antiemetics as prescribed. Question 20. A patient with multiple myeloma reports sudden back pain. What is the nurse's first action? A. Administer prescribed analgesics. B. Assess for spinal cord compression. C. Encourage bed rest. D. Notify the oncologist immediately. Answer: B. Assess for spinal cord compression. Question 21. A nurse prioritizes care for a patient with esophageal cancer. Which symptom requires urgent attention? A. Difficulty swallowing solids. B. Coughing with blood-tinged sputum. C. Mild heartburn after meals. D. Weight loss of 5 pounds. Answer: B. Coughing with blood-tinged sputum. Question 22. A nurse delegates tasks for a patient receiving a blood transfusion post-chemotherapy. Which task is appropriate for a UAP? A. Checking for transfusion reactions. B. Assisting with patient repositioning. C. Verifying blood compatibility. D. Monitoring vital signs during transfusion. Answer: B. Assisting with patient repositioning. Question 23. A patient with ovarian cancer reports leg swelling and pain. What is the nurse's first action? A. Administer a diuretic. B. Assess for deep vein thrombosis. C. Encourage leg exercises. D. Notify the oncologist immediately. Answer. B. Assess for deep vein thrombosis. Question 24. A nurse assigns tasks for a patient with prostate cancer receiving androgen deprivation therapy. Which task requires an RN? A. Measuring urinary output. B. Monitoring for hot flashes and mood changes. C. Assisting with hygiene. D. Changing bed linens. Answer. B. Monitoring for hot flashes and mood changes. Question 25. A patient receiving gemcitabine reports severe nausea and vomiting. What is the nurse's first action? A. Administer an antiemetic as prescribed. B. Assess hydration and electrolyte status. C. Encourage small sips of water. D. Continue the infusion and monitor. Answer. B. Assess hydration and electrolyte status. Question 26. A nurse is caring for a patient with a tunneled catheter for chemotherapy. Which finding indicates a complication? A. Mild soreness at the insertion site. B. Purulent drainage from the catheter site. C. Secure dressing over the catheter. D. Patient reports mild fatigue. Answer. B. Purulent drainage from the catheter site. Question 27. A patient with renal cancer on sunitinib develops hypertension. What should the nurse monitor closely? A. Hair loss. B. Blood pressure and cardiac function. C. Nausea and vomiting. D. Skin dryness. Answer. B. Blood pressure and cardiac function. Question 28. A nurse prioritizes care for a patient post-chemotherapy with anemia. Which symptom requires immediate intervention? A. Fatigue during activity. B. Chest pain and shortness of breath. C. Pale skin tone. D. Decreased appetite. Answer. B. Chest pain and shortness of breath. Question 29. A nurse delegates tasks for a patient with thyroid cancer. Which task is appropriate for an LPN? A. Assessing for neck swelling. B. Administering prescribed thyroid medication. C. Developing a radiation safety plan. D. Educating on post-thyroidectomy care. Answer. B. Administering prescribed thyroid medication. Question 30. A patient with bladder cancer reports hematuria. What is the nurse's priority action? A. Encourage increased fluid intake. B. Assess the amount and pattern of bleeding. C. Administer a urinary analgesic. D. Notify the urologist immediately. Answer. B. Assess the amount and pattern of bleeding. Question 31. A nurse assigns tasks for a patient receiving palliative chemotherapy. Which task requires an RN? A. Assisting with daily hygiene. B. Managing breakthrough pain. C. Measuring fluid intake. D. Repositioning the patient. Answer. B. Managing breakthrough pain. Question 32. A patient with chronic lymphocytic leukemia develops night sweats. Which condition should the nurse suspect? A. Chemotherapy toxicity. B. Disease progression. C. Allergic reaction. D. Radiation side effects. Answer. B. Disease progression. Question 33. A nurse cares for a patient on zoledronic acid for bone metastases. What is a priority intervention? A. Monitoring for alopecia. B. Assessing for renal function changes. C. Encouraging a high-sodium diet. D. Limiting oral hydration. Answer. B. Assessing for renal function changes. Question 34. A nurse delegates tasks for a patient with cervical cancer. Which task can a UAP perform? A. Monitoring for vaginal bleeding. B. Assisting with perineal care. C. Administering pain medication. D. Assessing for infection signs. Answer: B. Assisting with perineal care. Question 35. A patient receiving docetaxel reports swelling in the extremities. What is the nurse's first action? A. Continue the infusion and monitor. B. Assess for fluid retention and notify the oncologist. C. Administer a diuretic. D. Encourage elevation of limbs. Answer: B. Assess for fluid retention and notify the oncologist. Question 36. A nurse prioritizes care for a patient with brain cancer. Which finding requires immediate intervention? A. Mild headache. B. New onset seizures. C. Fatigue. D. Nausea. Answer: B. New onset seizures. Question 37. A nurse assigns tasks for a patient with testicular cancer. Which task requires an RN? A. Recording vital signs. B. Providing education on fertility options. C. Assisting with ambulation. D. Measuring daily weight. Answer: B. Providing education on fertility options. Question 38. A patient with sarcoma reports sudden leg pain. What is the nurse's priority action? A. Administer prescribed analgesics. B. Assess for fracture or tumor growth. C. Encourage rest and elevation. D. Notify the orthopedic surgeon immediately. Answer: B. Assess for fracture or tumor growth. Question 39. A nurse delegates tasks for a patient receiving bevacizumab. Which task is suitable for an LPN? A. Assessing for gastrointestinal perforation. B. Administering prescribed oral antihypertensives. C. Developing a symptom monitoring plan. D. Educating on bleeding risks. Answer: B. Administering prescribed oral antihypertensives. Question 40. A patient with lymphoma develops confusion post-chemotherapy. What is the nurse's first action? A. Administer an antipsychotic. B. Assess neurological status and electrolytes. C. Encourage family support. D. Notify the neurologist immediately. Answer: B. Assess neurological status and electrolytes. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!